If you're noticing that you're getting pain in the back and you think that it's your piriformis that's getting tight, and you're having a hard time stretching, like you constantly are stretching in this position and you aren't getting better, then this is the video for you. We're going to talk about one exercise that can open up this hip and get rid of that tightness, and you're going to be surprised at what it is because you're not even going to be stretching that muscle that is tight. Hi, my name is Stephanie. I am the owner of Empower Physical Therapy, and we help clients every day avoid surgery, injections, and medications. We have clients that have multiple failed treatments but come to our office and we're able to get their life back. That's who we see. So we often say, like, where the side of the pain is often not where the source of the problem's coming from. Other things that we see all the time in our office is that you have muscle tightness that's protection, but we go in to get a massage on that area and it doesn't get better because the muscle tightness is the protection. You've got to get to the source of the problem. And this is one of those cases that's just like that. So if you're someone that, again, is having a hard time, you've been stretching your joints this direction, going, golly, it's so tight, but I can't, it's not helping me. Or you're doing pigeon, where you're stretching like this, a yoga move, and you're like, golly, I just can't, it just won't go compared to the other side. Then we're going to show you a stretch here in a second on what to do. So very, very common. We see this all the time. We literally had a client in here just yesterday that was having that pain in that hip. And we were asking her, she was like, love to sit like this. And I said, cool, let's just see what happens on the side that you don't move very well on, that you have pain on. And she was like holding it and having to grab her leg and bringing it up here. And it was like up like this. And she goes, yeah, I stretch it all the time, but it just doesn't get any better. And her pain was back in that piriformis. And I said, yeah, absolutely, because you're stretching the wrong way. And this is why. So if you notice that, you get a massage back in through here where the tightness is and it comes right back again, we know that you're treating the symptom. Like that should be your first sign going, oh, wait, that's a symptom. I need to do something differently. Now, what happens is because we do certain movements daily throughout the day, like that are common patterns, maybe it's we always sitting and this leg is hanging out, or maybe you're always crossing your legs and this is the leg that kind of gets crossed. Whatever the case may be, there's positions that we get into over and over and over again that we don't even realize. And that creates these pathways in the joint. So it creates kind of that joint tightness, like that capsular tightness in certain areas. And what we find in our office is we usually can find one direction that opens it all up. And we're going to show you what that is here in a second. But another way I describe it to my clients is it's kind of like if you are in your backyard and you always walk in this one path to go wherever you go, to go to the garage or whatever. And if you keep on going down that one path in the grass, it creates this divot, this ruts, like this trail, essentially. And if you don't create that trail, then it all gets covered back over with grass and it's totally fine. Same thing happens in our joints, is we have things that we almost create these patterns in the joints, and it creates these kind of trails in the joints. And we have fat pads and bursas and different things that can kind of get displaced a little bit, and it kind of locks up that joint, and the muscles will protect and will be tight around it. And so our first instinct is, let's massage the muscle, let me get a tennis ball back there, but it's not working, and that's why. So when this client was like, oh, I'm trying to stretch, I'm trying to do this, and I can't, it's like not moving. I'm like, it's because you're stretching the wrong way. So we went and showed her this one stretch, and I kid you not, it opened her up like that. So you're going to get a strap because it's going to be important. So, and when we think about it, we can't get that rotation piece. So we need to add that rotation, but it's more of that rotation and flexion that we can't do. So we're going to take the joint into extension and rotation. Very similar. So we can like unlock it so that then it can actually move again. So if you want to go and get a baseline of that joint, you can take it here and just push down and just kind of see where it is. And you can see, the differences between each side, and then do this stretch. You're going to put the strap around your foot. And so what you're going to do is you're going to lie on a bed or a table. You're going to bring the leg up like this. So one leg up on a table or a bed, the other leg down. You want to stay up like this so that we get a little bit of hip extension in that hip. Now you're going to bring the strap to the other side. You're going to lift the leg up. You don't need to go very high. We're not trying to do like a quad stretch here. You just go to where the knee is about 90 degrees. And then you're going to take your hand off the table to where you're going to feel that stretch, that rotation in that hip. Make sure that hip's not coming off the table. Really keep that hip, this part of the hip, down on the table. Don't let it roll with you. And so having the leg down here is going to really help you add that pressure to keep that hip down. And then the arm just goes off to the side so you can get that stretch. And then you just breathe. And as you breathe, you're going to notice it's just going to start going down. And it feels really good. So you'll do about 3-4 breaths and then kind of bring it up and give it a little break. And then do that a couple of times. And, and then you're going to want to stand up or sit up again. And then you'll go in and see. When we did that stretch and then we had that patient lift her leg up, remember how she had to pull her leg to come up? She literally goes, oh my gosh, that's amazing. And you'll notice that this totally opens up the joint. And when you can get this joint opened up, what happens is because the joint's moving, the tightness in the back goes away. Now, if it doesn't go away, that's when you can, and the joint and everything is moving better, that's when you can go in and use a tennis ball to release the tightness through there. Because sometimes you'll get tightness that just shortens. It's shortened because it's been like this for a long time. Because honestly, we have clients that go from doctor to therapist, and they're doing all these exercises and soft tissue, and they're not getting better. And so that's when we can help you, because we can get to the source of it. And then when the muscles have shortened, then we can release it. So if you notice that the range is improved, then all you have to do is go get a tennis ball and roll out some of that tightness. And then now that tightness will go away. So do this stretch about like a couple times a day, 3-4 times each time you do it. And then really be conscious, keeping the joint where you're not like really rotating it. Keep the joint in its good natural position. And you'll notice that piriformis syndrome will go away just like that.